Let's move on to the scapulothoracic. Now this is obviously not a true synovial joint at all, and the joint mechanics are not based on the same principles. What we're actually testing here is, for the most part, is the extensibility of the soft tissues that control the scapular movement. And in very many cases this is a test of muscle extensibility, so we're looking for hypotonicity of the muscle due maybe to a palsy, or hypertonicity due to a facilitated segment. And there may or may not be adaptive shortening on these muscles that need to be stretched. Just lay on your side for me. Okay, stuck?
Yep.
Okay, come towards me this way. Okay, so we're going to look at just moving the scapula into the 4 quadrants. Probably the easiest hold is to allow the patient's arm to hang over your arm like so, and then you can grab the shoulder girdle above and then grab the scapula below here. So we're going to move the whole shoulder girdle. We will be moving it into elevation and retraction, and we'll be testing the protractors and depressors. We'll be testing it into depression and retraction, testing the elevators and protractors, and then moving it into protraction and elevation, testing the depressors and retractors, and then protraction and depression, testing the elevators and retractors. And we're looking really for the range of movement as well as the end fill. Are we getting too much movement or not enough movement? Now, we're not going to talk about this too much, but you have to wonder, for example, if levator scapulae is tight and it's restricting this protraction and depression, what's making it tight? And it's really incumbent on you to start looking in the neck to determine whether or not the problem lies in the neck. But to stretch these muscles out, which is not really a biomechanical technique, so I'll just talk about the easiest ways of doing this, and it's simply to take the muscle into the direction it doesn't really want to go into, and then applying a hold relax technique, don't let me move you, and relax, and then moving it further into that range, and then essentially stretching it into the range that it's not interested in moving into. Now, there are a lot more specific stretches for this region, but in fact it's important that you really get a lot more detailed knowledge on this. So this tape really isn't the place to be talking about muscle stretching.